to the Health Studies How-To series. My name is Melissa.
I'm China.
And I'm Lauren.
This video will cover the different study options and what may be appropriate for your research question. Depending on your research question, there are several types of studies that could be used. It's important to gauge the pros and cons of different study types and what they can and cannot accomplish.
We will outline 5 different study options and help you to decide what might be the best fit for your research question.
It's also good to keep in mind that some studies may not be suitable for a community group to undertake and may require professional assistance.
In addition, there may be more than one study that seems appropriate, and this is okay too. Maybe there are creative ways to combine different study approaches to best fit your research needs.
Study type 1, mapping. This study type includes both exposure mapping and outcomes mapping. Exposure mapping leads to maps of exposure, and outcome mapping leads to maps of disease distribution.
Exposure mapping. Exposure mapping helps communities visualize sources of pollution and to possibly pinpoint patterns of exposure. Example questions that exposure mapping could be helpful in answering are:
which neighborhoods are closest to the farms where sludge is sprayed?
Are there child care centers within walking distance of a highway?
Some exposures are very clear, while others may require information from government agencies.
Disease mapping can help visualize patterns of disease in an area. For this type of mapping, information must have already been collected. Example questions that disease mapping could help answer are:
where in the streets or neighborhood are lung cancer cases located?
Where in our town are the highest number of pedestrian accidents?
Knowing how to map locations of exposures and health outcomes allows you to combine the two to see if there are any patterns in the community. For instance, you could use the combined maps to see if the west side of town has more cases of brain cancer than in other neighborhoods, because that's where the hazardous waste site is located.
Study type 2, studies of exposure. This type of study includes environmental monitoring, a body burden study, and environmental impact statements.
Environmental monitoring looks for and measures concentrations of toxicants or chemicals in the environment. Some types of environmental monitoring are suitable for communities to undertake, while other types may require assistance of a professional lab. Example questions that environmental monitoring could help answer include:
is there lead in my garden soil or house paint, and how much?
Are there dangerous chemicals in my drinking water? What kind and how much?
A body burden study, or biomonitoring, measures chemicals within a person's body. These measurements are found by taking samples of body tissue, blood, urine, saliva, hair, nails, or breast milk. This study would be the best designed for questions like:
is there lead in my blood, and how much?
Have I been exposed to PCBs, and is there evidence of them in my body? Environmental impact statement. An environmental impact statement, or EIS, helps describe the environmental impacts of a new development, such as a highway, or changes to an old development, like an old landfill. This type of study is not typically undertaken by a community member. However, information gathered from this type of study can help answer questions like:
how will building a power plant in this area affect air quality?
How will construction of this highway impact water runoff? Study type 3, studies of health outcomes. Community surveys can be conducted by going door to door or calling people in your area to find out certain information, such as:
are you experiencing any health problems?
This information can be used to answer questions like:
what health problems are a concern to my neighborhood?
An analysis of disease registry data or vital events data. Disease registry data can be collected from a local hospital, and it can be used to compare death rates or rates of diseases, like cancer, in specific areas. It can also answer questions like:
does our town have a higher rate of lung cancer than the state average?
Study type 4, studies of exposure outcome relationship. An ecologic study helps to answer questions such as: are there more health problems in places where people are more highly exposed?
An ecologic study helps find out if there is a connection between some exposure, such as being close to a landfill, and some health outcomes, such as a respiratory illness, across a set of geographic units, such as a town or a city. Some questions to ask when using an ecologic study could be:
when I look at the cities within my state, do those with higher lung cancer rates also have higher numbers of hazardous waste dumps?
Throughout the USA, do communities with coal-fired power plants have higher rates of asthma?
A cohort study asks the the questions, what's the difference in disease risk among people who have a particular exposure and people who do not? A cohort study tracks an exposed group of people over time and compares their health risk to another group that is not exposed. Questions that might warrant a cohort study could be,
are the people who live near a hazardous waste dump more likely to have cancer than the people who lived far away?
Are the people who worked in the chemical factory more likely to have lung problems than those who did not?
Case control study. A case control study can be used to answer questions such as, are people with a certain illness more likely than other people to have had some specific exposure in the past? A case control study compares people who have a specific illness with people who do not. Examples that a case control study could help answer could be,
were children who have learning disabilities more highly exposed to lead paint as infants than children who do not have these disabilities?
Study type 5, studies of contaminated sites. Risk assessment answers questions such as, what type of chemical exposures are people likely to have from this site? What is the overall level of health risk from this site?
Risk assessment helps characterize contamination at a certain site and estimate the potential for human exposure and health impacts. Questions that a risk assessment could help answer could be,
what is the lifetime cancer risk for drinking water laced with chemicals from this contaminated site?
public health assessment. This study uses information from past studies to see if exposures at a specific site, such as a hazardous waste site, have certain health outcomes. This assessment could be used to answer questions such as,
what are people's actual exposures at this site?
Have people's actual exposures to this site made them sick?
These descriptions are introductions to help you start thinking about the different study types and possibilities, and what may be appropriate for your research question.
the next section will go into much further detail for each study type.
Remember to look at these study types with your research question already narrowed down.
Thank you so much for watching our how-to series. Be safe and healthy.
Bye!